All right, well, I got 12:04, so we'll go ahead and get started because I know a lot of people, you got plans you got to get to, so I don't want to go over. So we'll go ahead and get started and people will join in as they can, I suppose. So again, Jill Slavin, and I am a diabetic educator here at Valley Professionals. I always try to remember to say that, and I think I forget to say it. So I want to remind you that Valley Professionals is a little bit unique in that we have a diabetic educator, but we also have, which would be me, but we also have a care coordinator, if not more than one, in every building, and they can do really a lot of what I do. Also would help with education on diabetes and any health education something you'd like to learn more about. Definitely contact your provider, your clinic, and talk to the care coordinator. So I try to remind everybody of that because it's a unique thing that I don't think most family practices have. It's unique here at Valley Professionals. I don't think even most federally qualified health centers have that. So we're a little bit more unique in that area, at least. So this month's presentation is on being prepared. And I'm the kind of person that likes to be prepared. I don't have to have everything written exactly, specifically down. Like if we're going on vacation, I like a little bit of variety, a little bit of, hey, let's do this off the beaten path. But overall, most people, I think, feel kind of comfortable with some kind of preparation. So we're talking specifically about someone, family members, or you maybe that are listening, being prepared for sick days. DKA is diabetic ketoacidosis. We're going to talk more about that. Being prepared for when you travel and for emergencies. And these are times that I think, blood sugar, well-controlled blood sugar is so important, and it becomes even more important sometimes in these 4 areas. So as long as we go along, if you have a question, you can add it in the chat, and I'll try and keep an eye on that also. You can raise your hand and we can stop the presentation and answer your questions or talk more. Some of everything that I present, again, I always try to point this out too, is just what I have found through the American Diabetic Association or the American Association of Diabetic Educators, or even the ACE guidelines, which are the endocrine guidelines. But you should always talk to your own doctor, your own provider, healthcare provider, whether it's a doctor or nurse practitioner. Always talk to them for the final answer. These are just suggestions and guidelines that I have found. But that's always something maybe a little different with you and your doctor or nurse practitioner. So I always want to preface it with that. So I would think that it's always good to be prepared. But when I started doing this presentation, I was trying to think, well, is there any time it's not good to be prepared? I couldn't really think of any, except maybe like those surprise gifts that some people like to get. And so if you like those surprises, I guess that would be, sometime that it's nice not to be prepared, because if you like surprises, which I keep saying that because I don't really care for surprises, well, even if it's a gift, I'd rather have a little bit of a heads up. So if that's something that, you really like, there are good times, I guess, to not be prepared. But I think putting aside all of those nice surprises, most people like some kind of a plan. And I think it's especially important to have a plan when it comes to managing diabetes. Usually I find it with patients I've worked with, when there's no plan, when they're not following a plan, that's almost always when things go awry and when things aren't going as well as they could. So I hope with this presentation to encourage you to start making a plan in some areas. Everything doesn't have to be perfectly planned out. Even when you have a plan, sometimes it doesn't go exactly as you planned it, but at least in some of the things we're going to talk about today, I think it's going to get you more prepared for if one of the things we talked about, an emergency or illness, or, whatever happens in your life. If you already have something prepared, they're less likely to cause more stress. It actually should help control stress. And in that case, help control blood sugar, because stress is one thing that can actually make blood sugar go up. So, and I think we've talked about this at the diabetic group for years, since 2015, when we started having the diabetic groups that used to meet in person. But I think in the last few years, with COVID, this is definitely something I talk to patients about all the time. You got to be prepared for when you are sick. To me, waiting till the last minute for some things used to maybe work, but it doesn't always work as well now. And we'll talk some more about that. But when you're sick, monitoring your blood sugar becomes even more important. So having the supplies on hand so that you can continue to monitor and actually probably check your blood sugar more than you normally would. So You may need to check your blood sugar maybe every 4 hours, maybe even more often. Consider, if you think about some of the symptoms that you might have when you're sick, I don't know, you could be tired, you could have a headache, nausea, of course, vomiting, maybe you have a fever, so you're sweating. Some of these symptoms are the same symptoms as low blood sugar. So how are you going to know if you're having low blood sugar or high blood sugar if you're not checking? And when you're sick, that's sometimes the last thing that you want to do. You may not feel like checking your blood sugar. So if you have a family member or friends, whoever helps you manage your blood sugar or helps you out when you're sick, teach them how to use your glucometer. Let them do a blood sugar check on you. Maybe they'd be willing to do that if that's how far they're going when they're helping you when you're sick. I know family members, that don't normally help out with that, but when the person's laying in bed and doesn't feel like checking their blood sugar, they're going in there with the monitor and they're checking their blood sugar about every 2 hours, because they realize when you're sick, if blood sugar gets out of control, actually it can lead to other problems. And we're going to talk about DKA here in a little bit. So another thing that's important to do that you might not do normally, although I think a lot of my patients do keep a blood sugar log, but it's really important for you to keep a log at this time to write down what your blood sugar is and maybe what time you took it. With that said, there is a sick day record attached, or there's going to be at the end of the presentation, or Haley will send that out in an email. And, making copies of that sick day record and having that in a place that when you are sick, you're going to keep track of blood sugar, you're going to keep track of it in one place. If you had to call the doctor with your symptoms or come into an appointment, if you let them know how your blood sugar has been by specific numbers and times, that's going to help them know better how to help you. So I know I talk about continuous glucose monitors a lot. I'm almost getting tired of hearing myself talk about continuous glucose monitors because I talk about them so much, but they are pretty amazing. And if you have a continuous glucose monitor like a Freestyle Libre or a Dexcom, you're golden when you're sick, because all you got to do is scan that sensor, or with the Dexcom, it's continually downloaded. Or think about a family member. They won't have to poke your finger and get the blood sugar checked that way. They can literally just scan that sensor, or in the case of the Dexcom, look at your phone or the receiver. So if you've thought about getting a continuous glucose monitor and would like to talk more about that, again, check in with our care coordinators at every office, or call our clinic, the Rockville Clinic, and ask to speak to me. I can't promise I'll be here, but they'll send me a note and I'll get back with you. I think, when you're sick, monitoring your blood sugar is so important, and having a continuous glucose monitor that can actually make life a little easier for you when you're sick and when you're not sick would be a great thing to look into if that's something that you're interested in. We can see if we can help you with it. When you're sick, it's always good to continue to take your diabetic medications. Now, I know, unless your doctor has told you not to, I always want to preface that. And I know when you're sick, it's the last thing you want to do is think about taking medication. If you are on oral diabetic medications, try to take them. But if you're nauseated, and you think you're going to vomit, or you have vomited, say you just took the medicine and you vomited, don't retake the oral medication. With that, you're not sure how much actually got absorbed in the body. And if you were to retake it, you could actually be doubling up your dose. So it'd probably be better, to definitely don't retake it, wait till the next dose is due. If you take insulin and you're not going to eat, so there's, you got two different insulins. You got the meal insulin that you take, and you got the long-acting insulin that you take. And if you're not going to eat, it is safer to not take your meal insulin. And I say that with a preface that I work with Dr. Rico, who's an endocrinologist, and we do some things different. Like we have correction for our patients, and that's a whole nother story. But I'm just talking your plain set amount or your carb ratio that you take with your meals. If you're not going to eat, it's better or safer to not take your meal insulin. However, with your long-acting insulin, your basal insulin, your insulins that are called Lantus, Levemir, Basaglar, Tresiba, Dr. Rico, the endocrinologist I work with that comes to Valley Professionals, is always fine and actually wants you to go ahead and take your basal insulin, that long-acting insulin. That is not given based on the food that you ate. And it is a basal insulin that can actually be working behind the scenes and keeping your blood sugar well controlled, but not causing you to drop, not causing your blood sugar to drop. I would again suggest you talk to your own doctor to see what their plan would be when you're sick and you're actually giving insulin. But the basal insulin is always one that you can continue to give even if you aren't going to eat. And your oral medicines, if you don't have to eat with them and you take them normally when you haven't eaten and you think you can stomach them, go ahead and take the oral medicines. But if for some odd reason you're so sick that you vomit them, don't double up, don't take the dose again until it's time for the next dose, and see if you can actually take them then. Managing your blood sugar when you're sick by staying hydrated is always and being prepared ahead of time. Having these drinks ahead in your house so that you don't have to go out and get them because you don't feel like it, or having someone else go out and get them is always a good idea. Try to drink at least a half a cup to 1 cup at least. I think I don't know if I have every half an hour there. I can't see it. I think I have every half an hour to an hour. Yeah. Even if you do it in very small sips, that might be easier on your stomach, but just constantly trying to stay hydrated. And what do we mean by when we say staying hydrated? Because I throw that term around a lot, but what is the definition? And one of the definitions that I found was that, when you're well, a lot of times I'll tell my patients at least 64 ounces at the minimum a day of some, fluid. Specifically, I would encourage water, but actually some people actually say they suggest to stay hydrated, you have to follow by taking about 1/2 to 1 ounce for every pound you weigh. So let's just say you weighed 140. Of course, that would be 70 ounces to 140 ounces. So that's about 9 cups to 17.5 cups a day. A lot more than that 8 cups of that 64 ounces that I tell a lot of my patients to, that's the minimum. So if you want to even take your weight and, think about that, it's about a half ounce to an ounce for every pound that you weigh. So pretty simple to figure up. And it's so important when you're sick because, sometimes you, of course, can't eat when you're sick, but usually you can, not always, but sometimes you don't feel like eating, but you can almost always sip on something. I have all kinds of examples there. And so with that said, the second point there, these liquids should have no sugar. That's what I found in most of the things I was reading over. But, I tell my patients, if you're able to drink water, diet soda, or tea without sugar, or whatever you choose to drink when you're sick, and you are, you like it, it's okay, even though it doesn't have any sugar, that's fine. But I think what's important is that when you are sick, you've got to find the things that that you can consume. And if it takes drinking 7-Up or Sprite with, some sugar, or some Gatorade with some sugar, at some point, it might be a little bit better than nothing at all. So I think finding the balance for that. It's what can you drink or what can you eat or drink when you're sick. It's best if you can eat your regular diet. That's not always going to happen. So I always suggest eat whatever you normally can eat when you're sick and have it on hand. Have it there so that you can go get it. You don't have to go looking for it. We're going to actually talk about having a sick box ready to go. And then, of course, adding plenty of liquids by sipping those liquids throughout for an hour and a half. If you've been sick to your stomach, and these are things you might already know, but if you're sick to your stomach, nauseated, start by drinking those clear liquid, broth, tea, apple juice, or eating like Jello or popsicles, things that are very light and easy on your stomach. It's important when you have diabetes and you're sick to get something in your system. And sometimes that's really hard. So keep in mind that illness in general can make blood sugar go up. Dehydration can make blood sugar go up. And if you're not taking your medications, it can make blood sugar go up. So if you think about it, you're going to compound the problem if you don't try to do something to kind of control blood sugar or help out some way. And so giving your body what it needs, trying to take your medication, trying to keep hydrated, might be some help when it comes to managing blood sugar when you're sick. Here's a list of some foods and the amount that actually equals up to about 15 grams of carbs. So, when people hear, regular soda or ice cream or, Jello, sugar-free or not, or a popsicle or sherbet. Well, if you watch the amount, which usually when you're sick, you're not overeating. If anything, you're not eating at all. So you're not going to be overeating. And this gives you the amount. So those applesauce cups that are those little cups that you can get already, put together, you just peel back the top, half a cup, about 15 carbs. The little things of Jell-O or pudding, about 15 carbs. Saltine crackers, 6 of them, about 15 carbs. That's about all you're eating when you're sick anyway. You're not overeating. So that's why I try to encourage my patients. If you can eat those diet, the sugar-free foods and the sugar-free drinks when you're ill, more power to you. But if you can't, you have some options. So look at this list. It could be a shopping list. We're going to talk about, like I said, creating a sick day box here in a second. And these would be some things you'd want to put in it. Most of them don't go bad. The saltine crackers, they can get old and get stale, but they don't go bad. Even, the Jell-O and pudding cups they may have a date on them, but it would be in the, quite a bit of time in the future that they would last for a while. So yeah, you might want to check those expiration dates on those things and do a rotation. But, these are some things you can actually have in a sick day box and ready to go. And by the serving, it's about 15 carbs. So you're not going to be overdoing anything. Even the fruit juice, comes in the little bottles that you can actually purchase. So, you're going to have to find what you can consume when you're sick. You may have to let go a little bit of following the American Diabetic Association to the T, like you usually try to do. You may have to let that go a little bit until you're well enough to follow it again. But this list can help you maybe if you're going out, going to go to the store and create this sick day box. These are just supplies that I think you should always have on hand, food and drinks to always have on hand. And if you have to put them in a box or a tote of some sort and put them in a cabinet or the pantry so that they're there for you and you don't actually go and eat them or someone else doesn't eat the food or drink the drinks that you have on hand. These are things just to be prepared. It's best if you have extra medication, extra testing supplies, extra glucose tablets or gel. If you have glucagon, make sure you have it on hand. And if you're a type 1 diabetic, or if you've ever been concerned about ketones, and we're going to talk a little bit more about them in a little bit, then have some ketone strips on hand. It's always good to have some of these, have things extra. And what I mean by that with medication, if your insurance will allow it, maybe think about getting the 90-day prescription. Talk to your primary care physician about that and see if you can get a 90-day prescription, not just for medication, but all of your testing supplies. And even with that 90-day prescription, making sure that you don't wait to the last minute to get those medicines filled, because you don't want to be almost running out and then you get sick, and then what? Someone else hopefully can go get the medicine for you or your testing supplies. But if you can have extras on hand, then that's going to save time. And to me, it's going to reduce your stress. Glucose tablets, those last for a really long time. I don't even know if there's an expiration date on those. So having those are the things you would take if your blood sugar is going low. Glucagon is a medication that your doctor would have to send in, and that's if your blood sugar is going so low that someone else and even you need to give yourself glucagon to bring blood sugar up. In that sick day box where it's going to be, everything's going to be in one place, it may sound a little strange to you, but being all prepared ahead of time with some of the food that that we looked at on that list below, that is a good thing. That's going to make you feel more prepared and less stress. If you think about it, I don't know about you, but I've got drinks in one cabinet, I got water in another cabinet, I've got, if I had any of the applesauce, we have that in another cabinet. When I'm sick, I don't feel like going all around the house finding these things. If you can go and get that one box and take it next to you, and everything you need is in that box, and also the people who are going to be helping you or taking care of you, it's going to make their life easier. Also, you're going to be reducing stress and hopefully get well soon. So think about creating a sick day box, and in that box also, which is attached or going to be attached, keep that sick day record. It actually has a lot of this on it. The record, the page does, and it kind of just is a record of. It's a place to put phone numbers. It's a place to keep track of blood sugars. And it also gives you some of these hints, like drink so much, every so many hours, and try to sip on water or hot tea or whatever it is that you need, but constantly trying to stay hydrated. It has some of those tips on there also. So having that in the box for you to have just that handout to review when you don't feel well would be good also. Some people wonder, and I think more often than not, sometimes put off calling the doctor. So when should you call the doctor? If you have diabetes, we are even more concerned or wanting to be more careful. If your blood sugar level gets below 70 and it's unexplained, or, clearly if you've not been eating or whatever, it's a good idea to go ahead and call. And I think before I go any further, I think it's always better to err on the side of caution and go ahead and call us. Here at Valley Professional, you're either going to talk to the nurse or one of the care coordinators, and they'll send a note to the doctor, to the nurse practitioner, and they'll review it and see if there's anything that they see that they think we need to, do immediately. But it's always a good idea to give us a call. If your blood sugar levels are over 200 for more than 2 checks, if you're vomiting and unable to keep any fluid or anything down, if you have a fever, which is usually considered above 101.5, that's usually considered a fever, or if you have an illness that lasts more than 24 hours, you have been vomiting or have diarrhea for more than 6 hours, you have moderate to large amount of ketones in your urine for more than 6 hours, or you have severe pain in your stomach, chest pain, or you have a hard time breathing. And I know if you call us and you mention chest pain or having a hard time breathing, there's a good chance, the front off or the ladies who answer the phone are going to send you straight to the ER or suggest the ER. But sometimes I think when you're sick, I don't know about you, but some people that I know of put off calling the doctor, like, oh, I'll be fine, I'll get better. But there are actually some guidelines that you should follow of when you should call. And like I said earlier, it never hurts to go ahead and call. It's better just to be safe and let your provider know what's going on. And, maybe they'll see something or they can do something to hopefully make you feel better sooner. So along with being prepared for when you get sick, and inevitably there's always, unless you're just that one person in a million that just seems to never get sick, you maybe don't have to worry about it. But being prepared when you're sick is important, and being prepared to pay attention to symptoms. So when you have diabetes, it's a good idea to always be paying attention to if you're having low blood sugar or high blood sugar symptoms. Don't ignore them. One reason it's very important to pay attention to the symptoms, abnormal symptoms, is when or if you actually have diabetic ketoacidosis. And I'll probably call that DKA from now on, because as we do the presentation, because it'll be easier. And that's what we usually call it in the medical field, is DKA, diabetic ketoacidosis. So what's strange is I meet with diabetic patients all the time. We talk about diabetes, we talk about a lot of things, and rarely does anybody ever ask me about this, but it does happen. What DKA is when your body doesn't have enough insulin to help get glucose into the cells for energy, and your body needs glucose for energy. And even when you're sick, even if you're not moving, your body is using glucose for energy just to make us think straight. Our cells all need glucose. Think of all the things going on in our body and we're not even doing anything for it. Well, they're using glucose for energy. So if your body can't get enough insulin to help you get the glucose into your cells, your body will start breaking down fat for energy. And when the body breaks down fat, it produces acids called ketones. When too many ketones build up too fast in your body, they can build to a dangerous level. And the reason I highlighted too many ketones building up too fast is you may have heard of the keto diet, you may have heard of the Atkins diet, and those low carb diets, people actually can check their ketones, and they're not usually ever going to get that high. They're going to get high enough because it's going to show that, yeah, your body's burning fat instead of burning carbohydrates, but not to a dangerous level, not too many building up too fast, which can be dangerous. So let's talk a little bit more about DKA. It usually develops slowly. Some of the early symptoms are being very thirsty. So I put unusually thirsty. So if you normally are pretty thirsty, then what I'm pointing out is you would notice a difference. It would be unusually thirsty. Urinating a lot more, which makes sense because you're drinking a lot more or you're more thirsty, so you're consuming more. But those are some of the early symptoms. And again, that's why I said earlier, you got to be paying attention to symptoms, paying attention to if anything's different. If it's left untreated and blood sugar continues to go high, you can have fast, deep breathing, an unusual fast, deep breathing, dry skin and mouth, a flushed face, fruity smelling breath, a headache, muscle stiffness or aches, being tired, nausea, vomiting, stomach pain. The two that I've heard the most that a lot of times I'll see like in an ER report or something are nausea, vomiting, and stomach pain. And if you think about those symptoms, those are the same symptoms that you have with other things going on, like they'll call it a stomach virus or whatever. So I think it's very important. And I think most of the time when you go to our hospitals around here, they find out, or you will report to them, hey, I have diabetes, whether it's type 1 or type 2. let them know. You let them know maybe you've been sick. Sometimes being sick, and we're going to talk about that. That's one of the times when DKA is more likely to happen. And so they can be more aware that, hey, it could be more than just a stomach bug or whatever, but as I look at some of these other symptoms like a headache or muscle stiffness, don't assume just because you have muscle stiffness or aches or a headache that, oh, I got DKA. That's not true. Think about, these are more severe symptoms that occur and they appear quickly. So think about, okay, I have muscle stiffness and aches. Well, I just mowed yesterday and the lawn is horribly rough. And so of course, I'm going to be stiff today. Don't attribute to some of these symptoms to automatically having DKA, is what I'm saying. You evaluate your symptoms and realize other things possibly could be affecting it. And if your blood sugar is very high, and if you think that this might be the case, then it doesn't hurt to call the office and talk to somebody. If it lasts too long, then you're going to be wanting to go to the ER, because we won't be able to do what needs to be done in our office. If you wait too long, you'll want to go straight to the ER. But very high blood sugar and low insulin levels lead to diabetic ketoacidosis. The two most common causes of having high blood sugar and low insulin levels are illness. When you get sick, you may not be able to eat or drink as usual. You may take, which can make your blood sugar levels harder to manage. You may not have insulin on board. Like if you're type 1 diabetic, you're going to need insulin. Being insulin dependent, you have to have insulin. You don't feel like taking it, blood sugars can rise. Another common cause of DKA is missing insulin. So a clogged insulin pump, or someone taking the wrong insulin dose, like maybe the doctor said, hey, I want you to take such and such amount, and you never increased it, and blood sugar continued to stay high, and it's just gotten out of control. So again, I think it's always a good idea, if you are having questions, if this may be something that you're experiencing, to call your doctor immediately or go straight to the ER. One way that, most of the time we don't prescribe ketone testing for every patient who has diabetes, but a lot of times, especially with someone who has type 1, we do suggest that they have ketone strips on hand, and these can be purchased at a pharmacy over the counter, or I think you may have to ask them about them and they'll get them out for you. But this is just if you're sick or your blood sugar is high, these are some guidelines to follow. And like I said, call your doctor if the ketones are in moderate or high. Elevated ketones, they're a sign of DKA, which is a medical emergency and has to be treated immediately. Dr. Rico pointed out the other day that somebody with DKA literally can die in a few hours. Like, you don't want to put this off. You want to go ahead and get it checked out. If you're ever wondering, you can get these strips and you can see that picture behind you. Literally, you go to the bathroom, you pee on it, you go to the bathroom on it, and then you put the strip next to the color. It kind of tells you if you're moderate, low, not at all, no ketones, and so on. And like I said, most of the time, we're more concerned with our type 1s because they do not have any insulin on board. If you're a type 2 diabetic, if somebody has said that you have type 2 diabetes, you have some insulin being, your pancreas is releasing some insulin. Although I will say this, if you're type 2 and now you're insulin dependent, meaning you need insulin and you have to have short acting with meals and long acting, then you're more like a type 1, but you're a type 2 and we're managing like a type 1. So you're insulin dependent. So if you are on insulin and you're dependent on insulin, then this is always a concern that you need to keep in. And really what it is you can either, check your ketones, especially have those on hand for if you do get sick, but also paying attention to symptoms and not ignoring them. And I keep stressing that because I have patients who literally, they were having symptoms and they're like, instead of actually coming in and calling the office, they just laid down in the yard and thought they'd feel better. It's like, no, you don't want to ever do that. You want to let someone know, and you want to call the doctor, get to the ER. So when should you go to the ER or call 911? If you have unexplained high blood sugar and your blood sugar stays 300 or above, it's always good, like this said at the top. If you can't get a hold of your doctor right away, then you'll definitely want to go to the emergency room or call 911. Unexplained blood sugar, you're just not sure why, and it's staying high and it won't come down. If your breath smells fruity, and someone else actually might point this out to you, you may not notice yourself, but others might point it out. If you're vomiting and can't keep food or drinks down, if you have trouble breathing, is always a reason to go to the ER or call 911. If you have multiple signs and symptoms of DKA, then you definitely want to get checked out. And I think the ER would be the better place to go, because like in our offices, we can't do a whole lot for you there, but in the ER they can. But it doesn't hurt to call us and tell us your symptoms if you're questioning whether you should go or not. So being prepared when you're sick, being prepared by paying attention to symptoms, and being prepared while on vacation. So hopefully a little lighter note than when you're sick and DKA, diabetic ketoacidosis. Let's switch the gears a little bit, and being prepared while you're on vacation. Some people may not like hearing this because when you're on vacation, it's that time of the year. Everybody's planning vacations. I hear them talking about it. They're taking a road trip. They're going to the beach. Most of the people I hear are going to the beach. They're getting away from everyday life. And it's a time to refresh and relax and re-energize. And sometimes when those routines change, what I notice is the routines in managing your blood sugar also change. So going on vacation, I'm sorry to say, does not mean you can go on a vacation from diabetes. Now, with that said, there are some things that, if you're getting overwhelmed and tired of managing diabetes and you just want to go on vacation, there are some things we can do. Like we have patients who are on insulin pumps, and we're like, when you go on a vacation, you don't have to remove the insulin pump to go swimming and all that. We actually switch them over to doing using insulin pens. So, there are some things we can do to kind of hopefully help you enjoy your time and your vacation. But I'm sorry to say right now, you can't go on vacation from diabetes completely. But you can take a holiday, you can enjoy yourself. We don't want diabetes to rule your life. And so if you make some plans ahead and we do some preparation, you can have an enjoyable vacation and be sure that nothing ruins it for you. However, there are some things to consider. When you're on vacation, sometimes you're either more active or less active, and activity affects blood sugar. So, if you're like me, you're going to go on vacation and you're going to be less active. I'm going to be the one laying on the beach and enjoying myself, reading a book, whatever. But if you're going, to the mountains and you're going to be hiking, that's going to use up blood sugar. So you could have a chance of having lower blood sugar. So in that case, you always want to make sure you have some snacks, some glucose tablets with you at all times in case you were to go low. At the same, as you're laying around the beach, you're not quite as active as you are, what you were before you went on vacation, then you might find your blood sugar is a little higher. So way to offset that is to get active. Also pay attention to what you're eating, and we're going to talk about that here next, but, try to pay attention so that, you're paying attention to serving sizes, not that you can enjoy the food and the meals that you're going to have on vacation, but try to really pay attention to serving size and definitely make sure you take your medication. And if you can get active a little bit, then that's going to help with controlling blood sugar. But either way, activity can affect blood sugar. It can be low if you become more active than usual, or it can go high if you actually are just laying on the beach, not doing anything. You might notice blood sugar is going up a little bit. Before I go on, another thing, especially with a lot of these pictures, paying attention. This is something we don't talk about a lot, paying attention to foot care. If you're on a beach, they always say it's not a good idea to walk barefoot, although I like walking barefoot on the beach. I think most people do, but it's not a good idea. There are always sharp things, even if it's not a shell that's sharp, there's other things that litter, whatever, that you could cut your foot on. So always wearing sandals or some kind if you're on the beach. And then if you're going to the mountains and go hiking, it's not a good idea to get brand new shoes right before you go. Bring the old ones that are comfortable and that aren't going to cause blisters, because if you put on a new pair of shoes, sometimes that's what happens and you're out hiking. A little bit different movement for the foot can cause blisters. And then always making sure that you have clean, dry socks on also. So we don't talk a lot about foot care. I think I actually have a month coming up where we're going to talk more about it. But specifically when you're on vacations, being prepared so that you don't, get a cut foot or get a blister or whatever that could ruin your vacation. Plus, keeping your feet safe, because sometimes over the years of having uncontrolled blood sugar, I don't want to say having diabetes. Diabetes doesn't cause neuropathy. Uncontrolled blood sugar causes neuropathy. So after many years of having uncontrolled blood sugar, you may not have as much feeling in your feet. You may not even realize you have a blister or a cut. And bacteria loves a high sugar environment. So if you have uncontrolled blood sugar and you have a sore, it's going to be harder to heal, and it can lead to more damage to your foot and more problems. So just a side note there on taking care of your feet also, and being prepared for that while on vacation. We all know that food affects blood sugar. On vacation, you're more likely to maybe eat more or at least different meals. It's a time when you want to be able to enjoy the foods of those areas that you're going. You may find that blood sugar is a little higher than normal. Ways to get that blood sugar better controlled is, try to follow the My Plate. It's a simple method of just evaluating your plate every time you sit down to a meal and try to really fill up on all the vegetables and limit more of the carbohydrates. So keeping that in mind, and then also, staying getting active. Take a walk after you eat dinner out with family. Everybody go for a walk, short walk. That's going to help a little bit control blood sugar. Staying hydrated can help blood sugar. Sometimes that's one of the things we tell someone who has high blood sugar. Well, go ahead and start drinking some water and see if we can get that blood sugar to come down. Especially if we don't have insulin that we can actually, suggest that they take some or whatever. So these are just a few things, though, that you can enjoy your vacation, enjoy your time with family, enjoy those special meals, and still control blood sugar. So planning ahead while you're on vacation can make it go a lot smoother. Keeping your day-to-day schedule close to what you normally do would be great, but that always isn't going to happen. If you always check your blood sugar at noon and then eat lunch, try to keep those schedules. That can help. But I know on vacation, sometimes that's the hardest thing. Routines get changed, and that's what we're looking for. We're looking for an escape kind of from the normal everyday life. But mainly always keep some glucose source on hand. Have a snack, have the glucose tablets that are in the picture, have the little snack crackers, whatever, have something on hand to help prevent low blood sugar, or to treat low blood sugar or help prevent. Carry water with you at all times in some way so that you can stay hydrated. Make sure that you pack some batteries so that you can make sure your glucometer is going to work. Wear these diabetic bracelets or a necklace or something to let people know that you have diabetes, and that way if something does happen, they can actually react quicker by knowing what might be wrong and maybe make a better decision to help you out, and then wondering what's going on. And the reason I say it that way is I talked to a lady the other day, and I have had patients before, and literally low blood sugar can make it seem like you drank too much. And I worked in the women's prison. There was no alcohol being drunk in the women's prison, but sometimes they would actually you would swear they were drunk, and it was their blood sugar. You check their blood sugar, and it was low. So, think about it when you're on vacation. If someone sees you acting kind of strange, are they going to immediately know that you're a diabetic, you have diabetes, and that you could be low? No, they might think, oh, they drank too much at dinner. So keep that in mind. Have a bracelet or something on you, especially as you're going into places where you may not be right with family all the time. You may be with strangers, and they need to know this so that they can make decisions based on that and not on assumptions. So one thing to keep in mind is if you're traveling and you're going to be flying or going to another country, you got to know the rules, and it's important to keep everything with you. As I think about you traveling, and you may not have everything that you need for, checking your blood sugar or your medicine, or you have to go through these checkpoints. So these things can be kind of important. Take time to review the TSA website regarding medications and devices. Keep insulin, syringes, pen needles in the same bag. That's going to help security know that these items are yours and for medication or for you to help manage diabetes. Remove the bag that you have all that in from your luggage, so that, because screeners are getting used to seeing all this, the pen needles, the pens, and everything. They're getting used to it, but this does help save time if you actually remove that bag from your luggage. If you have any concerns about any of your medicine or the equipment that you use being x-rayed, you're asked to have your carry-on bag hand inspected instead of going through an x-ray. In the United States, the airports, there's a TSA Cares. That's what it's actually called, TSA Cares. It's a program that can assist you to get through security, with all of the equipment. And I'm thinking of people who have, think about the continuous glucose monitors, even think about insulin pumps and all the different medications that you might have with insulin, the different insulins, and whether it's in a syringe or in a pen or a vial, all that they're going to want to check. And TSA Cares is a program that can actually help you get through security and let you know what you need to do to get through security quickly and safely. Keep all your medications with you. You know, if you think about it, your luggage could be lost. You know, an insulin could freeze if it was in the cargo hold of the plane. So it's best that you keep your your medication and supplies with you. And I think of, again, continuous glucose monitors and insulin pumps. What I found was you can continue to wear your insulin pump and your continuous glucose monitors only while you go through common security systems such as airport metal detectors, as it will not harm this equipment. But these equipments should not go through, this equipment should not go through X-ray machines. So Medtronic actually has conducted testing on the effects of the new full body scanners at airports with Medtronic medical devices like insulin pumps and their CGM. And they found that the ones that have X-ray, you really need to remove that equipment. Your insulin pump and your CGM, don't send those devices. They said that can just ruin them. So you need to not send them through. It's best if you just jump online, print and copy the information of the airport emergency or print an airport emergency card to carry with you that has all this information on it. Notify the security screeners when you come up to them that you have diabetes, you're wearing an insulin pump and carrying supplies with you, and tell them about the continuous glucose monitors. If it's just a regular scanner thing, you can go through, but if it includes an X-ray, which some of them evidently do include the X-ray, they really don't want those. Their Medtronic specifically does not want their equipment going through. They don't think it's gonna ruin the equipment, and we don't want that, especially at the beginning of your trip. So I think probably the best thing if you're going to be going through an airport or to a different country, checking it beforehand, being prepared so that you know what needs to be done so that nothing gets ruined. So that you can enjoy yourself, you can take a vacation, you can get away, and you don't let diabetes rule your life. You're going to get a step ahead of it and plan so that you can have that great time you're looking forward to. And then another downer, are you prepared for disaster? I guess because really it doesn't take a whole lot to be prepared, again, for those nice surprises, but sometimes for these surprises that are not so nice, these disasters and sickness and illness and diabetes or DKA, it's not fun to have to be prepared for them. But I think when we are prepared, we're less likely to have as much stress. So, we live here in Indiana, you think, well, what disasters can we have? And if you think about it, you know that we have tornadoes, we have floods, we can have fires, we can have a blizzard right there in the middle. So we know that they happen, we can see them on the news, but I wonder, do we ever really think they're going to happen to us? And I always think there's two ways we can react, that someday a disaster is going to emergency situation is going to happen in our area. We can either react and do nothing, or we can prepare. And I think sometimes we've gotten so used to the pharmacy's always open or the store's always open, so I can wait till the last minute. But really, it's better if you start when you have diabetes to not wait to the last minute, but be a step ahead. It's important for everybody to do emergency planning, but I think if you have diabetes, to me, it's even more important. And I think, you need to be prepared if you were to have to leave your home in a hurry because there was a fire or whatever was going on, or there was no running water or limited communication or the stores were closed. It's just, we gotta start looking out for ourselves and being prepared. And again, I think just the last few years have really brought this home. I know, I think it is CDC or the Indiana State Health site talks a lot about getting prepared for disasters, and they put all this together with whether it's a natural disaster or just some reason you got to get out of the house and get out quick. So they suggest creating a go bag, to-go bag. Find a bag that has enough room in it to carry some water, some food. Of course, the food would be non-perishable. Maybe a small first aid kit, your prescription medicines, over-the-counter meds you take, any diabetes supplies you use, hygiene items, maybe a flashlight, all this stuff that you can keep. Some of the stuff you can keep in the bag, and like your medication, maybe the last minute you can go to a cabinet, you keep it and put it all in the bag. But keep this bag in a location that's not likely to get damaged. Like you wouldn't want to keep it in the basement, and if you're in a flood zone, so keep it somewhere where you can get it to it quick and you can get out quick. Put all your essentials If you think about it, you can go a few days without brushing your teeth, you're going to live, but you cannot go without your insulin. The rule of thumb is to have a 3-day supply and try and put the 3-day supply. So you'll need a bag that size. You can live longer without some food, but you're going to want some water or something to drink. So think about that too as you're filling the bag. These are just some things that, you might put in it. I mean, when we did this in a group, we actually had things on the table and we had the patients choose what they would put in it. So these are just some ideas of things you might want to make sure that you have. Some of them you can put in and leave them in there, like even an extra monitor. You could get a Walmart brand. I know Walmart has one called Rely On. It's a cheap glucometer, but you can even get one of those and some strips and leave it in the bag and not use it until maybe it was needed. Those strips do expire, so you'd want to keep an eye on that. But batteries, alcohol wipes, some granola bars, all of your testing supplies like Lancets and a Lancet device, just bottled water. There's ketone strips if that's what you want, glucose strips. Of course, your insulin and stuff would need to be kept in the fridge unless you were using it. But, the extra, think about those, and they're called Friho. It's Frio. I've seen them on Amazon, but they're the bags that you can actually reuse, the little thing that you put in water and it gets cold again. And it's a bag that you can carry insulin supplies or your insulin in, because insulin really should really stay cold or cool, but not frozen. So you think about hard candy, hand wipes, things to keep clean. Have this to-go bag ready to go and be prepared. So my challenge to you is, we've talked about a lot today. We've talked about being prepared if you're sick. We're being prepared, having a sick day box, being prepared if, to pay attention to symptoms. So in case you are heading towards diabetic ketoacidosis, you get a hold of that quickly and let us know, or go to the ER. Being prepared to go on vacation, so that a vacation, even though you're changing your whole life routine, doesn't get you out of the routine of managing your blood sugar. And then, just being prepared for any kind of emergency, natural disaster that might happen. When you have diabetes, it's so important to have all this in hand, because stress, illness, dehydration, all these things can actually compound and make blood sugar more difficult to control. So we need to think about ahead of time what we need to do in these instances before they happen, so that we're ready to manage those instances and manage them a lot better, so that blood sugar can stay better controlled. It's never, I don't know who came up with this, this quote, but I found this quote: it's never too late to plan until it's too late. So if I'll challenge you just to choose one of these things, either get a sick day box. If you are someone who doesn't have diabetes, but you have family and friends who do, talk to them about getting a sick day box, getting a to-go bag ready to go and starting to make a list. If you're going on vacation, making a list ahead of time of those things you're going to need, and going on to the websites, the TSA Cares or whatever, and getting ahead of it, so that you aren't left, they don't take away any of your medication, or any of it gets ruined if you go through a scanner. But I'm just going to encourage you to get busy planning and being prepared, and not putting those things off anymore. I think to me, it's one way of actually helping to manage blood sugar in ways we don't really think about a whole lot. All right, I've got one question, but it may be an old one. Yeah. One person, they buy lemons and add a little lemon water to get some vitamin C. And actually, I was going to put that, speaking of the lemons, and I saw this at the dollar store the other day. I buy the, I think it's called True Lemon. It's actually dehydrated lemon juice, and I can put that in water. So yeah, adding that to the water when those stay good forever. So you can put those in the go bag, or if you like sipping on lemon water when you're sick, having that in the sick day box would be a good thing to do for sure. Yeah. Any other questions or comments?
Jill, I have just a clarification. For the ketone self-check kits, we do not need a prescription for that. Is that right?
Yeah, so what I found is that you can literally just go to the pharmacy and ask and say, could I have a bottle? Like, it's just like a little container of ketone strips. Yeah. Now, if you have type 1, there are ketone machines, that your doctor may have a certain name brand of the ketone strips they want you to have. You can always check with them, but people who do like the Atkins diet or the keto diet, literally, and I thought they were like actually the ketone containers and the strips were sold over the counter. But I know one time many years ago, I had even asked the pharmacy and they got them from behind the counter. But yeah, I did not need a prescription. I just had to ask the pharmacist for them. I don't know why. Maybe I don't know if people were taking them or why. It was behind the counter with the pharmacist, but I didn't have to have a prescription. So no, unless your doctor specifically wants you to have a certain, ketone machine, or a certain kind of strip, that maybe they think is more accurate, that's something they would have to decide. But if you just want to get some ketone, actually the picture, the ones I got look like that picture, which just in a container, and you go to the bathroom on it, and literally it changes colors, and you just compare it. It gives you a general idea of where you're at if you have, low or moderate amount of ketones.
Okay, thank you. And I have one comment just to reinforce your sick day comments and how to manage that. I had a friend of the family who, young, insulin dependent, but young man, pretty well educated in his condition and all, but he'd gotten fairly sick overnight, and in the morning told his wife to go on to work, so was home alone. Sister just happened to stop in and check on him when she heard he was sick, and said, "You look terrible. Have you checked your blood sugar?" And he said no, he hadn't been eating, so he wasn't checking his blood sugar. She said, "I am taking you to the hospital. I don't like the way you look." So she ended up taking him in. He was close to diabetic ketoacidosis because he had inflammation of his appendix. So there again, if he would have laid there all day, by evening when his wife got home, it would have maybe been a pretty critical situation. So his sugar, I think, was over 700 when he got there to the ER. So anyway, good example of exactly what you were trying to reinforce.
Yeah, definitely. And Dr. Rico, the endocrinologist that I work with that comes to Valley Professional twice a month, has said that, literally in a few hours, if that guy had laid there, who knows what might have happened. Yeah, blood sugar is 700, getting in that dangerous area. I always tell my patients that, they should call the doctor no matter when their blood sugar is above 300. Give us a call. Definitely at 400, you need to call us. I said, because there's going to come a time when you won't be able to do anything at home. You really need to get to the ER and get some fluids, and then they'll give you some insulin. But if blood sugar gets really high, you don't want to just give insulin immediately. It can actually cause a switch in your cells and the fluid in your cells, and it can cause more damage than, if it gets that high in the 700s, they really need to get to the ER to get some fluids. But yeah, if a few hours of those symptoms, and again, remember, it's rare, it doesn't happen often. When diabetic ketoacidosis is happening, it's when you don't have enough insulin and your blood sugar is high. Well, how are you going to know if you're not taking your insulin? You're going to know you don't have enough insulin if you are insulin dependent. And how are you going to know if your blood sugar is high? You got to check it. That's why I was trying to emphasize, check your blood sugar when you're sick. It's even more important, almost more important when you're sick to check your blood sugar it is than when you're well. So yep. All right, everybody. Well, thank you. I will see you next month.